All right, welcome back. More than 7,000 New York City girls aged 17 and under get pregnant every year. 90% of those pregnancies unplanned. And in order to deal with the issue, the New York City school system began a pilot program last year allowing students to get emergency contraception. The program, called Connecting Adolescents to Comprehensive Health, or CATCH, is now expanding, and we've been asking you to weigh in. Let's get around the table here. T.J., I know you don't think it's a good idea. Why?
Well, my problem is also with the consent. I'm concerned about, look, they put it in there for a reason. They put in the consent for a reason. They think it's important enough. But then again, it is not airtight. It is not reliable.
Okay, here's my question.
Yeah.
Parent signs, are you okay with it then?
Well, that puts it in their home. That puts it in their control. That's where it comes into parenting. And by the way, that's the second part of my problem. I don't necessarily buy the narrative that the majority of these parent-child relationships are dysfunctional and that there is no openness. I don't buy
Dominic,
that.
You mentioned where these schools are, and that makes a difference. They're not going to Scarsdale High School or...
Of course not. I'm really torn about this, Richard. I agree with everything Kelly has said. Now, and I'm really torn. My mother, I'm one of those kids. My mother was pregnant with me when she was 16 years old in the city of New York in public school system. I met my father, my dad, maybe 2 times my entire life. The man never signed my birth certificate. I don't have a father on paper. So this is real important to me. So I understand that side of it. And then I'm also a father with a 24-year-old daughter. And I am telling you, if I never received that form, I'm one of those parents that would have a lawyer, because maybe I'm more fortunate than most, I would have a lawyer at the school the next morning commencing legal action, because how dare you make a decision for me like this without my permission. But at the same time, we have to be real. Most of these kids in communities of color are having babies on top of babies. So, I mean, and nobody wants to talk about the race part of it, but we have to be real. In terms, they're not graduating from high school. 50% are dropping out every year. We know if they don't finish high school, they're done. But at the same time, you wouldn't take this program to Scarsdale High School because, frankly, the predominantly white parents would sue you until you turn blue.
Does he have a point, Kelly?
Your point about the rate of unintended pregnancy and rate of teenage pregnancy among teens of color being higher than white teens is absolutely true. And I think that's the beauty of this program, recognizing that and wanting to bring it into schools where it is most needed. Because it's not that teens of color are having more sex than white teens, it's that they don't have access to the education or the healthcare services that they need to prevent unintended pregnancies and to have safe sex. And so I think that's why the program is great.
Is that a fact, though? Forgive me. Is that a fact, though? Do we know that for a fact that they're not having as much sex in between the two communities? Is that actually, you're saying that quite with authority. You're saying that with authority.
But
I'm wondering, do we have numbers on that?
Are we saying that kids of color have more sex?
I'm asking. No, I'm not implying anything. I'm literally asking.
This is getting off the beaten path. The point is, you got kids that aren't ready to have kids, right, that are getting pregnant. And if we can even get past the window that in the first 72 hours you can stop this before there's a pregnancy, if for all intents and purposes, is it a good thing? And I'm not going to get into the life and the choice debate here, Andrew, but informed consent seems to be the sticking point for a lot of people who have gotten beyond that debate and to say, wait a minute here. The school is acting not only in loco parentis here, but they're really taking it one step too far. If we said, A, this goes across the board to all schools, and there needed to be a requirement that parents either opted in or opted out, would it really make the program that invaluable?
Well, I think it would undermine the effectiveness of the program that they were trying to institute in those schools and establish the criteria that's then going to allow it to spread across the entire city, where it will not be confined to just particular schools, where it will be available to everybody. The other thing that seems to be left out of this equation is that with all these parents screaming, but where's my input, where's my input? Keep in mind, these are the young women who are engaging in this behavior and then taking themselves to seek this assistance, to seek this treatment.
Well, here's the problem.
Clearly,
when asked, you'll verify this, a lot didn't even know even about the existence of the program.
Well, it's only in a little over a dozen schools right now.
But even in the schools, not everybody even knew about the existence.
I understand,
so
but you know what?
Self-responsibility, some didn't even.
But the parents of those young women wouldn't be on the other end of a notification phone call anyway, because because they didn't receive the treatment.
But
guys, these are the young women who are coming forward.
It just stinks. Because what the system is really saying, and you have an African-American schools chancellor in New York City, but what the system is really saying is, you people don't know how to control your children.
No,
that's exactly what it's saying.
No, this is
okay, take it to Scarsdale.
This is where
take it to Scarsdale.
They're taking it to every city.
They're not taking it to Scarsdale, and they're not taking it to Scarsdale because those parents are not having it.
First of all, Scarsdale's not in New York City.
Second of all, take it to Stuyvesant High School.
They are taking it to Stuyvesant High School. They're taking it to every school in the city as a result of this pilot program.
I see it.
We just reported that it's going to go citywide. I don't know how much more evidence you need.
It's 5 to 13. It's not going to every PS
It's
across.
a pilot program. It will
It's not going to every school. It's in communities of color where the system feels that those parents have no say and we do whatever we want to your kids.
I got to bring up one
bottom
more
line.
Point. All of this boo-hoo, I'm a parent and my hands are being tied and the city's taking action without my consent. You know where your consent also isn't being applied? In the activity that your kids are engaging in.
Here's the point where I think
No,
Andrew,
because
with all due respect,
with all due respect,
I'm going to play the parent card, which you're not,
Sure.
okay? And I'm only telling you, for parents who care, okay? And I'm not going to say every parent cares of all these situations, but there are parents who both have to work. And you're doing you're doing everything you can to give every opportunity to your child. You're not home till 7 or something at night. Time out. And it's not because of indifference or whatever else. To suggest here that there's negligence on the parents' part because the kids from the 8 hours of 3 o'clock to whatever are doing, I'm not even saying that I'd want, God forbid, my young child to have her own child. I'd like to at least know that she's engaging in this kind of risky behavior so that I could, if I have to, one of us has to stop working, one of us has to take action here to be around to help the child. In the end, I'm not saying, to bring this full circle to you, Kelly, that I know what the right answer to this one is, but it's a difficult conversation, and people wonder where this goes even 10 years from now. I mean, remember the whole conversation about condoms in schools? Oh my God, now it's the morning after in school with some form of informed consent. Is this the end of it, or do you think that there'll even be more rules for schools when it comes to not just sex ed, but birth control, and then the step after that, if there is conception, the next steps after?
Well, this program, remember, is not just about emergency contraception. It's about the full range of reproductive health care services, including birth control pills, other forms of contraception. And emergency contraception, or the morning after pill, is just one tool in that arsenal of taking care of yourself and being a responsible teen if you're being sexually active. And so I think when you think about it in context of the range of services that teens need in order to be safe and healthy, then it makes sense.
A question was asked to me. What if a child comes in and says that she was the victim of a sexual assault, and she wants to have the morning after pill, but she doesn't want to go to law enforcement authorities? Would the parents be notified then?
My understanding of physicians and anybody involved in the education system is that they're most likely mandated reporters. So I'm not an attorney and I couldn't really speak to that, but I would think that that a teen and a responsible healthcare provider would be able to make the decision and get the information.
We'll keep this conversation going after the break. Stay with us. We'll be right back.